Now time is over. It's 9:15. So today is May 21st. Today is May 21st. Fast Coder 21's pre-medical coding, CPC, SDS, AMS prep session 25, pathology coding. Yeah, of course, you can change your domain. Everything depends on you. So how much interest you are showing towards to learn new domain. So anyone can change any domain. There is no restriction. So guys, now it is 9:16. Just answer this question. We will discuss the answer at 9:20. Yeah, Syed, you can change any domain. There is no restriction on that. But everything need or everything depends on you and your determination. So in medical coding, no one can restrict you that you need to do SCC coding, you need to do only inpatient like that. But the thing is that getting the job is very important. So as you are a SCC coder, companies need to provide the opportunity. So for that, you need to do hard work by learning inpatient coding if you want to go. If you want to go surgery, you need to learn surgery coding. So whatever it is, if you want to go inpatient coding, you have few videos on FastCoder 21. And if you want to go surgery, you have few videos on FastCoder 21. You can watch those videos freely and attempt interviews. So if you attend the interviews only, you will get the knowledge. So what are the interviewers asking? Yeah, thank you, Sarika. Thank you very much for your answer. So we have 2 more minutes. So Alina, are you trying to do this question? So for example, if you take me myself, I have experience in all codings like inpatient, ED, SCC, surgery, and radiology. So there is no restriction on that. You can do whatever coding you like. So we have 1 more minute. And remaining guys, mention answer in the chat box. If the answer is wrong, also no problem. So as you know, knowledge is ocean. Every day we need to learn new things. So if you do mistake only, you can learn the new things. Okay, guys, we will discuss now. So 32-year-old has had no prenatal care. Fundal height indicates a term fetus, and by dates it is determined she is 38 weeks pregnant. Okay. Few hours prior to admission to labor and delivery, her membranes ruptured spontaneously. She does not have fever, but the physician performs a rapid antigen test for group B streptococcus. So this is the keyword here. Physician has performed antigen test for group B streptococcus. Hi Vidya, good evening. So an enzyme immunoassay method is performed. So this is also one keyword. Physician obtains a lower vaginal swab, then observes that it visually shows the patient is negative for the antigen. Okay, good. If clinical risk factors appear, intrapartum antibiotics will be initiated, which lab test is reported. So as usual, we will start with lower level code, so which is C 86317. So here we need to check group B streptococcal test. 86317 we will check. What is 863? 86317 for immunoassay for infectious agent antibody quantitative not otherwise specified. So basically it is not related to antigens. So C is wrong. 86317 is wrong. Next we will check 87450. So we need to check antigen testing. 87450 infectious agent antigen detection by immunoassay technique, enzyme linked immunoabsorbent assay. So single step method not otherwise specified each organism. So this is not. We need to check for antigen. So this is basically if the document contains ELISA, we need to code 87450. Next we have 87653. What is 87653? So 87653 is Streptococcus group B amplified probe technique. So this is not related. We need to check for antigen. So we are left with A 87802. What is 87802? So infectious agent antigen detection by immunoassay with direct optical observation Streptococcus group B. So based on our report or document, physician has performed antigen test for group B streptococcus. So here our answer is 87002. So just you need to check for the keywords. So in document we have group B streptococcus. In our code description also we have group B streptococcus. So 87802 is the answer here. So we will mark here. One second, we will make it as green color. Okay. Next question, please. So now the time is 9:24. We will discuss the answer at 9:28 based on the reply. So you don't need to worry about the answer. Just you need to have a zeal to learn new things. So whatever it is, whether it is correct or wrong, just mention your answer in the chat box. So if you don't know the answer, no worries, we will discuss. So in order to motivate you and in order to know the CPT guidelines by yourself, I am not showing my CPT book with you. So you need to use your CPT book. So it's good for you only. So now the time is over. We will discuss the answer. Thank you, Vidya and Sarika. So here the patient's presents with burning urination and frequency. Okay. The physician performs a UA dipstick which shows elevated WBC. Okay. He orders a Thank you, Alina. He orders a urine culture with identification for each isolate to determine which antibiotic to give to the patient for the infection. What are the appropriate lab codes? Each isolate to determine which antibiotic. So we will check the answer now. So our we will start with 81000. So what is 81000? This is urinalysis by dipstick or tablet reagent for bilirubin. So this is not correct. So we will check 81002. So this is non-automated without microscopy. So we will check 81001, which is automated with microscopy. As we have two codes, we need to check other codes also. We will check 87086 and 87088. 87086 and 88. 87086 is culture bacterial quantitative colony count urine and 87088 is with isolation and presumptive identification of each isolate urine. So, we had urine culture with identification for each isolate to determine which each isolate. So here our answer is, so 87088 D. Answer is D here. Yeah, we will check even with these confusing ones. 81001. So here our answer is C, 81001 and 87086. So which is C. Culture bacterial quantitative colony count urine and also automated with microscopy, but that is I think not correct. So we will check next week that question. Basically, based on mock test, it is C answer. C is the answer. One second, we will check. So we will check the last. Meanwhile, you guys can try this one, 12th one. So now it is 9:33. We will discuss answer at 9:36 or 37. Yeah, exactly, Paramila. I am checking the answer now. So meanwhile, you try for 12th one. So I will check at my end. You guys can check 12th one. So guys, 11th question answer is 81002 and 87088, not C, for which B is the correct answer. Try to remember. B is the correct answer. So as here, physician performs UA dipstick with no identification of macroscopic test. So based on documentation, he did not mention any microscope. So we can't code 81001. So 81001 is for automated with microscopy. 81002 non-automated without microscopy. So we need to code B. So 81002 and 87088 is the correct answer. Yeah, we will check that. So 11th question answer is B. Try to remember. It's B. So we will discuss the answer now. So which are the following code combinations is an example of unbundling? So basically unbundling means coding multiple codes instead of single code. So in CPT guide, based on CPT guidelines, whenever we have more comprehensive code, we can't code individual codes. So it is unbundling. If you code individual code, it is unbundling. So here we need to find the unbundling code. So here our answer is C. We will check YC. So YC means here all the individual codes are coded instead of single code. So anyone write C? Yeah, no problem, Parimala. So 12th question, 12th question. Yeah, one second. So my system is running slow. Yeah, no problem, Parimala. Basically, while coding or while writing CPC exam also, you need to remember two words. One is bundling, second one is unbundling. So bundling means whenever we have comprehensive code, we need to code that comprehensive code instead of individual multiple codes. So unbundling means it is like coding the separate codes whenever we have the more comprehensive code. So we will check. So 80048 and 80061. So what is 80048? So 80048 is basic metabolic panel. So what is 61? 61 is lipid panel. So first one we can code separately as it is not a bundled procedure. Why means both are different tests. So 848 is basic metabolic panel and 861 is lipid panel. Both are different, so we can code different codes. So we will check B 876. 876 is for hepatic function panel and 80300. 80300 is for, where is this? So I think series has changed. So what is 80300? So 1 second. 80300 CPT code. So it is basically screening for presence of drug. So we can code, those are not combination codes. We can code them separately. So we will check 861. So 861 is for lipid panel. So 83718. Next. So here we need to select the wrong code. 83718. 83718 is lipoprotein, direct measurement, highly density cholesterol. So if you see in C section, 861 is having lipoprotein, direct measurement, high density cholesterol. So in 861 we have description of lipoprotein, and also in 8, what is that, 83718 also you have same description. So here lipoprotein, direct measurement, high density cholesterol. So this is the unbundling. So what happens here, along with 861 we can't code 83718. Why means lipoprotein, direct measurement, high density cholesterol test is included in 861. So we can't code 83718. So in this question we need to find the wrong answer, not correct answer. So because of that reason our answer is C. So lipoprotein we can't code with 861. This one 83718 we can't code with 861. But based on this question they have mentioned 861 and 83718. Here in this question particularly we need to find the wrong answer for unbundling. So here our answer is C. Yes, we can't code 83718 along with 861. Okay, Sarika. So go ahead and try for this question. Now 9:45 we will discuss answer at 9:48. So Paramela, you got bundling and unbundling, na? So basically bundling means whenever we have major procedure code, we need to code the major procedure code. So if you code individual codes, it will become unbundling. So in the 12th question particularly, we need to find the wrong answer, not correct answer. So okay, Sarika. So you got means it is good. So very important concept in medical coding, this bundling and unbundlings. So try for 13th one. Yeah, thank you, Vidya, Alina, Divya. Good evening, Divya and Sarika. So answer C is correct. So here we need to remember only answer. So as we are not doing picks now, so no need to worry about this one. So 13th question answer is C. So basically here 70-year-old had fallen breaking her jaw. Okay, she has had difficulty eating after having her jaw wired. Okay, her doctor ordered a stationary parenteral nutrition infusion pump for her TPN. So TPN means total parental nutrition. A 7-day supply of a parenteral home mixed nutrition supply kit was also given. What HICPICS level 2 codes are reported? So you need to remember this one. B9006 B4222 into 7. Okay, leave that one. So try with this. Question number 14. This you can try. So in pathology, you need to concentrate more on bundling and unbundlings. So it's a direct question. First question of pathology and laboratory. Yeah, sorry guys. Now you can see four options. Yeah, yeah, good evening, Shiva Parvati. So you have 2 more minutes. Yeah, yeah. You all of you guys correct. So this is answer D. As here, this is the bundling. So all these tests are included in like calcium, carbon dioxide, chloride, creatinine, glucose, potassium, sodium, urea, nitrogen. All are included in 847. So we need to code 847 instead of C, as this is unbundling and this is bundling. So this one is good example for bundling, unbundling. So here, as we have a more comprehensive code, we need to code 847. As mentioned, all these tests are included in 847. Yeah, most of the people are wrote good only. Yeah, go ahead, do this question number 15. Now it is 9:53. We will discuss the answer at 9:57. So in CPT, bundling, unbundling is very important concept. You need to have good idea about bundling and unbundling. Yeah, thank you guys. Thank you very much for your answer. So, Dr. Rob performed an intraoperative consultation on a bile duct tumor requiring frozen section and cytological evaluation to a bladder tumor. How would you report his professional service? So, as usual, as soon as we saw professional service, we need to remember that we need to add 26 modifier. So here directly we can eliminate A and C as there is no mention of professional service. So we are left with two codes B and D. We will check 88331 first. So what is 88331? Pathology consultation during surgery, first tissue block with frozen section, as documentation contains frozen section here, and also 88334. 8833 is for cytologic examination, touch prep, squash prep, initial size, and 88334 cytological examination, touch prep, squash prep, each additional site. So here physician has performed procedure for only one site. So bile duct tumor. So here 88334 is an add-on code. We need to code this one. B is the correct answer. If we see guidance on under 88334, it is telling us to code. We need to code 88334 along with 88331 and 88333. So we need to code along with primary procedure. So here our answer is B. Yeah, all are correct. B is the correct answer. So Vidya, as you decided first, it is B. So here only how do you choose correct answer? Because of parenthetical note. So parenthetical note told us that we need to give 88331 is the primary procedure, 88334 is the secondary procedure. There are two tumor sites in this question. So go ahead with question number 16. Hi Gaurav, good evening. So Elena, you need to check one guideline under 88334 for intraoperative consultation on a specimen requiring both frozen section and cytological evaluation. Use 88331 and 88334. So based on that, and also we need to code professional service using the 26 modifier. So based on parenthetical note instruction, we need to code B, not D. Yeah, thank you guys. So, Elena, we need to check those parenthetical guidelines whenever you code. So, if you code live coding or if you write CPC exam also, we need to check first five codes before the code and after the five codes before the codes so that we can understand those guidelines easily, parenthetical guidelines. So, here a pathologist performed gross and microscopic examination of a breast tissue following reduction surgery and kidney tissue obtained from biopsy from a same patient. Code the CPT for examination of both tissues. So here, physician has performed two procedures. So as per CPT guidelines, whenever we have two separate procedures, in order to eliminate the bundling, we need to add 59 modifier. So using those guidelines, we need to code or choose 88305 and 8830559. So here what happened? Same procedure and two separate sites. So we need to code 59 modifier along with 88305. So what is 88305? So surgical pathology, gross and macroscopic examination. So if you check this description, we have kidney biopsy as well as breast biopsy also. So as breast and kidney both are different sites, we need to add 59 modifier. Okay, go ahead and check question number 17. So here you need to know the modifiers. Whenever you see modifier, you need to remember there is a technique. So you need to find the modifier usage first. Then you can get good idea. So it is one type of time saving skill. So if you like this session, please click on like button so that it will motivates me and provide more sessions. Yeah, thank you guys. So all are wrote correct answer. So I think basically here math calculations are included in the chemistry tests. So if you know the guidelines of pathology, you can find the answer easily. So here A is the answer. Only one thing you need to remember that Math calculations are included in or bundled with chemistry tests. So question number 18. So guys, it is basically 80502, not 505. Now you can find the answer. 80502. So no need to worry about the answer. Just write whatever you know. And here also Garg. Yeah, now you can check this. So we have 1 more minute. Basically, pathology is new for everyone, but when we read once, we need to remember the things, guidelines. So as you know, we will not learn pathology regularly. Only for CPC exam, we need to know the pathology codes. But whenever you read, you need to remember the guidelines. So even CPC exam also, if you don't have knowledge about pathology, just check the section guidelines and find the proper answer. So we will discuss this answer. Dr. Garg provided a comprehensive clinical pathology consultation. So if you see in your CPT book, you have one section guidelines, consultations, clinical pathology. So it's a clinical pathology consultation comprehensive. So this is the very important keyword at the request of Dr. Adams. This request was regarding a patient with various infections, drug allergies, skin rash, and Down syndrome. The patient is in the hospital intensive care unit being treated with intravenous antibiotics. Dr. Garg did not see the patient. So this is the very important keyword here. So based on E&M guidelines, we need to code E&M guidelines whenever physicians see the patient face to face. But here, based on this question, Garg did not see the patient. So here, there is no face to face evaluation here. So because of that reason, our answer is 80502. As there is no face to face interaction between patient and Dr. Garg, we can't code remaining B, C, and D. So here our answer is 80502, which is A. So here only one important guideline is if the physician sees the patient face to face, we can code E&M code. But based on our situation, document contains Dr. Garg did not see the patient. So it is not comes under face to face consultation. Because of that reason, we will not code 99,000 series. We need to code only 80502, which is for comprehensive clinical pathology consultation. Yeah, Shiva Parvati, you are correct. So here you need to check. It is a fundamental guideline of E&M evaluations. So whenever you want to code E&M code, you need to check whether physician see the patient face to face or not. If the physician sees the patient face to face, you can code E&M code. If physician did not see the patient, you can't code the E&M code. So based on that guideline, our answer is A 80502. So go ahead and check question number 19. So now it is 10:15. So that is a fundamental E&M guideline that physician needs to see patient face to face. Yeah, it is 19th question is direct code only. You no need to do more hard work here. So post your answer in the chat box. Yeah, thank you guys. Yeah, B is the correct answer. So all of you done very well. So B is the correct answer here. So happy coding guys. So if you have any questions, so now it is 10:18. So if you have any questions, I will wait for 5 more minutes. If you have any questions, you can ask. So next week, few guys asked modifiers. So I will try to conduct modifier session next week, one live session. Do you want live session or video for modifiers? So mention in the chat box, live or YouTube video. So whatever you want, we can make that one. Yeah, pathology is bit boring only. So as it is not a regular process, it feels like boring. But if you want to succeed in CPC exam, you need to go, you need to know the pathology also. Okay, Shiva Parvati. Yeah, no worries. So, but I think Shiva Parvati and Vidya, we have few videos related to modifiers. Already we have created videos related to modifiers. You can check once. 1 second. Otherwise, I will try to provide in the chat box. So we have multiple sessions for modifiers. So this is one video, and we have one more video related to modifier. So this is one more video. And Alina, we have few videos related to inpatient also. Do you want me to post here? So if you go to playlist on Fast Coder 21, we have playlist related to inpatient coding. So there you can find most common interview questions and how to learn PCS coding, and you have MSDRG basics and common inpatient interview questions. So you can watch those. So if you need any other specific video, just mention in the comment section. We can make those videos, Alina. So if you need any other topic related to inpatient coding, so mention in the comment section. I will try to make that video. No problems. So I will wait 2 more minutes. So no problem. After the session also, if you have any problems, mention in the comment section. No need to worry. So once again, thanks for Parimala, Sarika, Alina, and Srikant, Yasin, Sayed, Vidya, and Gaurav, Shiv Parvati, and also Divya. Thanks for your attending this session. So if you have any concerns, please mention in the comment section so that I will try to resolve your issues. So we have 1 more minute. Alina, if you want any particular topic related to inpatient coding, mention in the comment section. I will make video related to that topic, whatever it is. I can make one video for you. Just you need to mention in the comment section whether it is inpatient, outpatient, HCC, anesthesia, whatever it is. Just I need your comment. So thank you guys. Thanks for attending Fast Coder 21. Now I am stopping my live session.